So you asked for me to talk about how to take care of hyperpigmentation. So that's what we're going to talk about today. So here's the sad truth of the matter, is that once you get an age spot, melasma, sunspot, liver spot, freckle, that area is going to be prone to make brown in the future. So even if we make it go away temporarily, that brown will want to come back if it's stimulated, and it can be stimulated by sun, it can be stimulated by hormones, it can even be stimulated by heat. So really fighting hyperpigmentation is a multi-step process, and the first is prevention. It's protecting your skin so you don't make the brown spot in the first place, and so the brown spot doesn't come back after you have it lasered or bleached or whatever you choose to do. So prevention is sunscreen. It's fundamentally, you wear zinc-based sunscreen every day, you reapply it every 2 hours. That's our number one thing we can do to fight brown. Next really important thing is vitamin C. Vitamin C serums, antioxidant serums in general, but particular vitamin C, has been shown to fight brown and lighten brown. So every morning before I leave my house, I apply a good vitamin C serum and I apply broad spectrum zinc-based sunscreen. If I'm gonna be outside, like I was outside all weekend and it was beautiful, I'm reapplying my sunscreen every 2 hours. I'm wearing a hat and I'm wearing sunglasses. And I know that doesn't sound fun and you're gonna have to choose how much your brown bothers you, but if you wanna limit your brown, you have to take those preventative steps. Now, in addition to those, which prevents the formation of brown and the return of brown, how do we treat the brown that you have? Well, there's a lot of different forms of brown. There is brown that's caused directly by the sun, which are the sunspots and just the general sort of browning and irregularity of our skin. There's post-inflammatory hyperpigmentation, and that happens if you have a rash and you have darker skin. That rash can then become brown. It can happen if you have a pimple and that pimple gets inflamed and then goes away. It can leave a brown looking scar. You also can have brown from something called melasma, and melasma is the medical term for something called the mask of pregnancy, and it's when you make brown because of elevated estrogen, progesterone, as well as sun exposure and even sometimes heat exposure. So melasma is something that's really common in all women, but particularly women with darker skin types, particularly women who've been on the birth control pill for more than 10 years, and particularly for women who are pregnant or just been pregnant. So all of these can benefit from sunscreen and from the vitamin C serum. Other topicals you can use to help lighten brown are prescription medications like retinol, which is over the counter. The prescription version of that is tretinoin. You can have tretinoin mixed with an active, actually skin lightener called hydroquinone. Hydroquinone has a bad rap, but I actually am a big fan of it, and I let people use it 2 weeks on, 2 weeks off as necessary to help really limit the formation of new brown. And then there's a whole bunch of herbals that are over the counter that you can try, but really the two things that have been shown to work the best is prescription strength tretinoin and hydroquinone, and those actually mixed together with a little bit of steroid have been the most effective in lightening brown. That is a prescription called Triluma, and oftentimes your dermatologist can get that compounded for you, where it has the 3 ingredients: the tretinoin, the hydroquinone, and a steroid. And that steroid plays a role in inhibiting irritation, because oftentimes if you make brown, if you get inflamed, you're going to make more brown. So that steroid is an important step. You don't want to use that all the time. It's something where I let people use it maybe 2 weeks on, 2 weeks off, year round, or maybe use it for 3 months and then take 6 weeks off or 6 months off. So those are the topical options you can use. Now there are treatments in the dermatology office that can also really help fight brown. For people with a little bit of brown and wanting to improve their texture, the baby laser called the Clear and Brilliant is great. It's actually gentle enough that I let people with melasma use it in low settings, but oftentimes if you do high settings, you can still have bulk heating, and that can make your brown worse. So if you have a little bit of brown, if you have melasma, the Clear and Brilliant laser, which is a baby fractionated resurfacing laser, can be very, very helpful. If you have age spots and brown spots on your face, IPL, intense pulse light, can be quite helpful, but IPL can actually make melasma worse. So you want to make sure that your dermatologist is identifying what your underlying cause of your brown is, so they're using the right treatment, so we don't do something that actually can make your brown worse. If you have bad texture, wrinkly skin, and brown, the CO2 laser can be great for getting that off as well. But the CO2 laser provides a lot of heat to the skin. So if you have darker skin tones, if you have a family history where you have a grandma who has darker skin tones, that can sometimes be unsurfaced with the CO2 laser. So it's really something you want to convey to your dermatologist. Hey, my grandma's Native American, and so when I turn on that laser, I know I don't want to put too much energy in that individual, or they may make more brown than it looks like they actually have in their skin. There is a little bit of data about oral medicines helping with the fighting of brown, and tranexamic acid is the one that's been pretty popular over the next couple years, and it will help in particular fight melasma. And then the medication Polypodium leucotomus, which is actually an over-the-counter fern, has been shown to help a little bit with the formation of brown by providing your skin protection from the sun different than sunscreen. So that is a huge amount of information I just conveyed in 6 minutes, but let's back up and summarize. First and foremost, it's all about an ounce of prevention. So you want to use your vitamin C serum, you want to use your zinc-based sunscreen, you want to use them every day with your sunglasses and your hat if you're prone for making brown. If you have brown that you want us to make go away, see a dermatologist who knows what she's talking about, and make sure you get the right treatment to really lighten your brown without putting your skin at risk, and that is oftentimes lasering. There are some gentle peels that can be helpful as well, and those can be done in the dermatology office or at home. Glycolic acid is a really safe one that can be done on almost all skin types. Outside of the lasering and the over-the-counter prevention, there are bleaching agents which are topical, and that's the hydroquinone, or the hydroquinone mixed with retinol and a steroid. That can be used intermittently but should not be used all the time. Other little take-home points for everyone: don't pick. Picking almost always leaves a bigger scar and a darker scar than if you didn't pick in the first place. If you're prone to making brown and you do have a scab, a scar, a new injury, keep it out of the sun. Put a Band-Aid on it, put a silicone strip on it, do something so it doesn't turn brown in the first place. And if there's any other questions you have, feel free to DM us. I am happy to answer more questions.